Dr. Wan Nur Asmara Mohammad Noor had asked, is there any role of magnesium in treatment of osteoporosis and sarcopenia? Thank you. Oh, we also have, welcome on board Professor Natalia Grigorieva, Professor Marta Zeus, as well as the Associate Professor Karasievska Tetiana. Across your current condition from there.
Thank you for all the professors. Thank you so much, you know.
We can all give them a round of applause.
Yes, thank you so much.
Lecture.
Thank you for your wonderful time and your wonderful knowledge, you know. We are learning from each other. Thank you. These are Paulo associates, you know, from Ukraine.
Maybe we addressed this question to Professor Grigorieva. She is current president of Ukrainian Association of Osteoporosis, and I know that she has a brilliant answer for this question because she always gives us some lecture about the nutrition in treatment of osteoporosis and sarcopenia. Natalia Viktorovna, could you answer?
I will repeat the question, Professor Natalia Grigorieva. Is there any role of magnesium in treatment of osteoporosis and sarcopenia? Thank you.
Hello, everybody. Firstly, I would like to thank Professor Mike Chen and organizing committee for inviting me to this excellent meeting. It's a great pleasure and honor for me, and I hope for my colleagues to join us. It was an exciting conference, and I hope it will be useful for many practitioners. Of course, we talked about osteoporosis, and optimal nutrition is the important tool in osteoporosis prevention and treatment. And magnesium is one of the essential mineral elements for bone health. But if we discuss nutrition in osteoporosis treatment, we should know that three main elements in our daily ration is highlighted in your recommendation. The first one is calcium. The second is vitamin D supplementation, and the third one is protein. Unfortunately, or maybe not, magnesium is not in this list, but the many performed study confirms that magnesium plays an essential role in bone metabolism as well as joint metabolism. And the bone mass disturbances, the frequency of bone mass disturbances is higher in some region with magnesium deficiency. So we know it, and in our daily practice, we recommend for our patient the supplementation not only calcium and vitamin D, but other bone important micro and micro elements. I believe that it's important to increase the significance on our treatment.
Thank you everyone for your presentation across, both days. So Professor had just ended talking about placenta and just the numerous things that it does. And I'm thinking wound healing right now. So we have the placenta spray. Topically now, you're not injecting. So can we, the risk of, proliferation, cancer, tumor, whatever, does that still apply if we have diabetic foot and we're using placenta spray?
So anyway, just because if you know what you're treating exactly at the moment, if you definitely if there is a medical background of diabetes and then the patient develops the ulcer, that's one thing, of course. But when you're suddenly dealing with something that you haven't been, you have never seen a patient, then of course or you have to do certain medical examination. I'm just talking from the clinical case from my practice when we didn't really know what's did, and it was like kind of a terminal case. We didn't know whether it was like third stage syphilis or it was like a cancer of the skin. So in those cases, of course, you just like won't apply just because you don't know what you're treating. So you have to be extra cautious. Otherwise, when like, you know, it can be predictable kind of anyway, and you obviously don't want to apply it on some, you know, black kind of nevuses on the skin. So you should take everything, of course. No, well, very first statement is no harm, and yesterday professor told about it. But when we kind of we know what we are dealing with, at least like not with the you know, with the eyes closed, you know. So when you take everything with when you're cautious, yeah, it can be done. Yeah, no problem. Of course.
So my question is actually very specific to diabetic wound. It's very difficult to treat in general. So when you've achieved blood control, blood sugar control, this is standard. That's the first thing you should do. The wound still doesn't heal most of the time. And in fact, doctors back home now are recommending hyperbaric oxygen therapy, just anything, right? So my question really is, placenta spray is new for me. Is there any other thing that's new that you're doing or that you recommend that we could add to the regular regimen for diabetic wound?
I think it will work since we've been using like not only placenta but also mesenchyme for this kind of treatment, and we've been injecting it exactly into the granulations, you know. So we've been doing, of course, initial disinfection, then injecting the both placental mesenchymal peptides into the wound. They can work as topically as good, but you know, there was nothing, you know, maybe there was kind of overwhelmed you know, the wound was overwhelmed with certain MMPs or whatsoever. But nevertheless, at the end, like the progress was much faster. And of course, it's best to combine this modality of a treatment with hyperbarics. It has to be done a few times a week during the long time, and we know, like, you know, many different kind of wound. Not only the ulcers would heal, and this people sometimes they can spend hours and so on and so forth. But yeah, this is kind of modality of treatment, possibly one of the best ones. And they of course might consider certain nutrition on top of that and something else. But yeah, it works definitely well. Just because placenta has such a strong potential with all the growth factors. And when we're dealing with this particular case, I think the success is there.
Yeah. I would like to add, we have successful cases, and our staff, Stephanie, she's here, not here, she may confirm. She lately sent us the feedback on the email, as long as I remember. Very good results of wound healing, but there was a bad source, not diabetic food, which is also very hard to regenerate and to heal up. So the doctor that used our product, he used range fresh and pure placenta hydrolyzed. It's the molecules bigger than in our mito organelles. Yes, so it's hydrolyzed placenta. Just remember. It was administered topically, injected around the wound few times, once in 2 days or once in 3 days, and the bed sore totally healed up. So also can we use this one? Thank you.
Okay, I have a question. Thank you for the insightful presentation from everyone. I'm a doctor of physical therapy. So my question is regarding rehabilitation exercise protocol. So what would you recommend for the different condition, like you say, from muscle wasting from Dr. Simon, and then Prof. Mata on, you know, like inflammatory arthritis would be ideal to start post stem cell generation in terms of the initiation, the intensity of exercise, the type of exercise to support the tissue generation without causing any harm to the new tissue cells. Yeah, and Prof. Mike, would be good to hear from you for your opinion as well.
Well, first of all, depends on the type of intervention that was made initially. So what's the initial condition we're facing with? How much of degeneration is there? And then even let's say there is some kind of minimal degeneration after the intervention itself, let's say it's periarticular or intra-articular injection of whatever tool you are using. Of course, you have to wait for a while for just the local inflammation because of the intervention subsides. And then, of course, depends on the initial condition, but there is like a gradual scale when you limiting the motions first, and then you're starting warming up, then you're starting applying some weights. So yeah, it's just a gradual one. You can Google. I won't be able to name you each condition and each type of protocol, but yeah, just gradual, common sense increment in exercises. Yeah, nothing super special. Overall, you cannot harm the cells, the injected cells, with any kind of exercises, except for maybe first 3 days. The common recommendation is to abstain from like hot shower, hot bath, sauna, and general increment of the body temperature, but just for the first 3 days. That's the only recommendation. Other than that, there is no way you can harm injected, implanted cells with any kind of exercises. Yeah, they just should be considered in terms of like overall condition acceptance.
Okay, thank you.
I think our colleagues, Ukrainian colleagues, the author of a lecture about the inflammatory arthritis and sarcopenia, also would like to add something. Yeah, Professor Marta Jus or Association Professor Tatiana Karasevska or Natalia Viktorovna. Can you add something?
I think it's a very good question, but I think that probably is a part of a future investigation, because we should examine at what time, at what particular time we can add extensive exercises not to damage the tissue. But without exercising, there won't be any success in the treatment of the disease, because exercising is one of the part of the treatment. But the exact answer when to start, how severe exercising upload should be, I think we don't have exact answer.
Question?
Hello.
Yes.
Hi. I'd like to ask some questions. Yeah. So thank you very much to all the lecturers. Actually, my journey started in regenerative medicine from PRP, platelet-rich plasma. So I found it inadequate because most patients, when they're ill, like diabetic and everything, the lack of the. So I'm very interested in the placenta spray. Actually, I'm seeing a lot of diabetic wound patients. But the PRP has a good quality that I'm using the way of spinning. I can get the gel, so the fibrin gel acts as a very good way to heal them. So my question is actually on rheumatoid arthritis. So of course, there's the element of autoimmune disease. So I have also possible patients coming in with rheumatoid background as well. So how does the biological help to stabilize rheumatoid arthritis, apart from controlling inflammation, but the autoimmune aspect? So maybe can you please highlight to me on this? Thank you very much. Yeah.
Yeah, so absolutely correct. We have two factors. One is autoimmune condition. So we're addressing with certain immune therapies to modulate the immune system to stop attacking its own tissues with the help of ASI, active specific immunotherapy. It's kind of a vaccine which is prepared from the host's own blood, from the patient's own blood. And it's usually a course of 45 to 90 days, depends on the amount, on the duration of the course. Yeah, so we're addressing that autoimmune component with that ASI. Now the osteoarthritic component of rheumatoid arthritis, we're addressing same as regeneration of other tissues. So we can use precursors to the bone cells, precursors to the connective tissue, to the ligaments, to the muscles, to the cartilage. And it can be in the form of cells or in the form of peptides, in the form of exosomes, which can be actually in certain scenarios for intra-articular injection mixed together either with gels, either with hyaluronic acid, either with growth hormone. So it all can be combined.
Maybe our colleague also wants to add something.
Maybe we can join your discussion. Can we join?
Yeah, please.
Because we are all rheumatologists, Professor Marta Jus and Tatiana Karasevska and me, we are rheumatologists, and maybe my colleague have some comment. Colleague, what about you? Maybe me?
Dear colleagues, dear chairmen, thank you for interested in inflammatory arthritis and sarcopenia topic. As for me, be honest, we not used the same cells intra-articular injection in rheumatoid arthritis. Be honest, we not experience, we have no experience for this practice. But absolutely, there are absolutely strong link between inflammation, sarcopenia, and osteoporosis. That's absolutely proven. And firstly, when we deal with the inflammation, we need to stop the inflammation firstly, and then we need to think about the muscle and bone health. And in our practice, we do it in a parallel. We do it the synergistic, and we treat the underlying disease. Plus, we add we made to influence on muscle and bone in a line of base medicine. That is my opinion. So, please.
Could I continue this discussion? Few words.
Yes, please, Professor.
Thank you. I fully agree with my colleagues, and I would like to remember you that PRP is a good method for osteoarthritis treatment, and there are a lot of high-quality evidences and randomized trials and others that support that idea. But I think that it's a root approach for patients with anti-inflammatory disease, and especially rheumatoid arthritis. I don't use this approach in my clinical practice, and I would like to highlight that the main mechanism of PRP is the regeneration through inflammation. You should remember that. And use this approach, we increase the inflammation, and it's not very good for patients with rheumatoid arthritis. And I fully agree that maybe other sophisticated approaches can be useful in patients with autoimmune disease, but not PRP. Thank you.
Can I add also, we should remember that rheumatoid arthritis is not only autoimmune disease, it's also autoinflammatory disease. So it has both features of autoinflammatory and autoimmune diseases. And that's why I totally agree with you that we should be take in mind that autoinflammation can be accelerated by PRP treatment.
Good afternoon, everyone. I'm just a layman. I'm not a doctor, but I'm 61 years old already, and I started working out when I was 10 years old. So up to this day, I still play badminton like 5 days a week. I still work out and live a lifestyle of, eat right, sleep right. Now, I was just concerned with all these problems that are happening right now. It's like 1 in 5 men have osteoporosis. So at my age, how do I avoid all these things? I mean, because it's scary, because it's bound to happen one day, no? Any other suggestions? Aside from stem cell, of course, no?
And also, we are talking about the prevention of osteoporosis and bone fracture, so we need to advise you to fill in our questionnaire. Also, we can help you to pass the bone densitometry, as well as a frax risk assessment and assessments of risk falling. And after that, we can summarize what we can advise you to prevent the some bone fracture. So we have tomorrow some workshop, and you can be a volunteer for this research. Welcome.
Could I add
As
some words? Mhm.
Please.
Could I add some words?
Sure, of course.
Yes, Professor, please. Thank you.
Yeah. I fully agree, but I would like to highlight that not only exercise is important, the fall prevention is also essential, and the cessation of alcohol and smoking, and cessation of some moderate risk factor for individual person. And of course, calcium, vitamin D, and other supplements, they that will optimize our nutrition, because now we have a polynutrient deficiency, unfortunately, and so it's important for prevention of bone loss. Thank you.